media handles GTV Ghana, and you get more of our content. Like and share your thoughts with us as well. Our WhatsApp number is also active, 05555610034. And thanks to Red Cultural for our costume today. So on this side, we'll be talking about the shortage of vaccines across the country and the concerns that are being raised by civil society organizations, including one on our screens today. Send Ghana sent this one on the 1st of March last Wednesday, asking governments to purchase childhood vaccines now to avert an outbreak of childhood disease in Ghana. So we'll just go through what the statement said in a bit more detail. Send Ghana notes with deep concern the recent media reports of shortages of childhood vaccines in the country. This is quite disheartening, considering the importance of vaccines in safeguarding the lives of children. We ask the government to take immediate steps to purchase these vaccines and make them available to avert an outbreak of childhood diseases. For about a month now, health authorities have been paying lip service to resolving the shortage. It is reported that 10 out of the 16 administrative regions in Ghana are currently battling shortages of vaccines and are now turning nursing mothers away. This is hindering the country's goal of attaining universal health coverage and sustainable development goals more broadly. The government of Ghana over the years has not fulfilled its co-financing obligation with the Global Alliance for Vaccines and Immunization, Gavi. Ghana is now considered a stubborn child, in quote, among global immunization bodies. While we recognize the current economic crisis in the country, important needs such as vaccination for children cannot be compromised. Already, 120 children have reportedly been infected with measles in northern Ghana, and many more across the country could suffer a similar fate. We recommend that government retrieves monies used to purchase COVID-19 vaccines that were not delivered, as cited in the Auditor General's 2022 report, to purchase vaccines for children. We recommend the Health Committee of Parliament for inviting the Sector Minister, Kwekwa Agyeman-Manu, to respond to questions regarding the shortage of the vaccine. We further appeal to Parliament to use its powers to continue to sustain the pressure on the government until the vaccines are made available to all health centers across Ghana. We hope the government will speed up processes leading to the acquisition of vaccines to protect and guarantee the safety and well-being of children. Signed, Dr. Emmanuel Aifa, Deputy Country Director, Send Ghana. So this is the statement that was issued by the subsidiary of Send Foundation of West Africa. Dr. Emmanuel Aifa has joined us at the table, and he will be answering some of our questions and yours. Join the conversations also virtually and link with us on our WhatsApp number 055-55610034. If you have any thoughts to share on this subject, we would love to hear it. We'll also be talking to another stakeholder on our phone platform. So stay with us. Dr. Aifa, thank you so much for making time to sit with us this morning. Has it ever happened before that we've run out of vaccines? And what did we do at the time?
Okay, thank you for having me, and good morning to your cherished viewers. Yes, of course, it has happened before. But considering the state of things now, we think that the government has looked on unconcerned, and that is why we are adding our voices to it.
The government has looked on unconcerned.
Unconcerned, yes.
You just told us in this same statement that Parliament actually called the minister to answer the question. And I remember hearing the minister say that a procurement process had been put into effect. Have you heard back from any of those stakeholders?
Yes, as I said, the government has looked on unconcerned, but you are right that the minister was called to Parliament. I don't know whether you are aware that when the minister was called, he didn't turn up. And this is not the very first instance. It did happen during the COVID era when the minister had to go and answer some questions, didn't turn up. This time around too, he did not turn up. But we were told that some technical people went. there are certain responses that they couldn't actually give because it doesn't rest with them. What we know is that there's a promise that in 2 weeks' time the vaccines are going to be delivered. But it remains a promise because it's not the first time we are having this. You remember in our statement we indicated that this has become a lip service. Why we are concerned is it's because it borders on children, basically. Ghana happens to be one of the countries that has been doing very well as far as immunization are concerned in West Africa. It may interest you to know that in terms of coverage, using the Penta 3 as a proxy, we are doing around 99%, which tells you that it is good. However, there are some regional disparities. If you look at Greater Accra, if you look at Volta, if you look at Eastern also, it's around 75 to 85%. Urban areas, there are some inequities in there. And so you wouldn't want to wait until certain things happen. You didn't want to wait until a child dies. You wouldn't want to wait until measles degenerate to cause blindness that you want to act. And that is why we are so much concerned about this. In fact, we picked up signals middle of last year because we've been doing some research looking at immunization budget credibility in some regions and districts. That is when we picked up signals. Fast forward in November last year, it actually became evident there were some reported cases of shortages in the northern, in the eastern, and I think in Volta region also. And then when we did our national stakeholder deliberations on the issue, it became much more apparent.
Let's get a clearer picture of what we are potentially facing here. We have on the line Dr. Mameya Nyakon. She's the past president of the Pediatric Society of Ghana and medical superintendent of the Princess Mary Louise Hospital here in Accra. Dr. Nyakon, good morning. Thanks for joining us.
And good morning to all your listeners.
Thank you for making the time. How much of a worry should this be for us, looking at the current situation? Can you put it in a bit more of a perspective?
I think we all have to be very, very worried. And because, like it's been said, a lot of our children are born with very little immunity against these diseases. And the vaccine offers them protection in the early phase of their life, where they are at a higher risk of dying from these infections. And so if we don't have these vaccines, what it means is that our babies who have very little immunity on their own will not be able to fight these infections if they are exposed to them. And they'll either die from them or have consequences that can lead to some permanent disability in their lives. And so we all have to be concerned and strategize on how to solve this problem.
So help us understand, when we say there's a shortage, does that mean there is none at all in the system? Does that mean the stocks are depleting? What exactly does the shortage mean in this instance?
So in this instance, we are not getting the quantity that we usually get. And so you don't have enough to go around all the children. So let's say in the past you have enough to immunize 100 children on a day or over a certain period. Now you may get very little, maybe 20, enough for 20 children, enough for 10 children. And so you have to turn some children away when they come, and then they don't receive it at the scheduled time.
Who decides which child gets a vaccine and who doesn't? Because if you have to turn some away, it means that some process went into selecting those who would get it and those who wouldn't.
Oh, usually it's just the first come, first served basis. So whatever is available, whoever comes gets it. And if you come in late or by the time you come, it's all been used up, then that's it. There's really no special selection process.
And when this happens, what are the parents told?
So usually the community health nurses would take their phone numbers, and as soon as they have some available, they schedule a day. It may not even be the usual immunization day, but once they have enough that can take care of a certain number of children, they call all the parents and say, please, can you come on this day? We have this vaccine available so that we can give to your children. So that's what they are doing now.
It means that some of the deadlines are being missed because, as far as I understand, those vaccines should be administered at certain stages, if I'm not mistaken.
Yes. Yes, so sometimes they don't get it at the scheduled date, and they may get it some weeks later or some months later.
But do we know if those who have missed it already, give us an idea of the backlog that we are thinking about? So if there is a measles vaccine, for example, how long have we run out of that, and how much time has lapsed between that time?
So there's been, at least for me, I know that since the last quarter of the year, but in fact, some people actually said that the stockout started from about the middle of 2022. So there's been pockets of shortages in various places. And definitely in the last quarter, it was more significant last year that we realized that there were quite a number of vaccines that were available. So we give, for instance, for measles, we give at 9 months and we give again at 18 months. So then within children around those ages may have missed. So whenever it's available, they give it to them.
Is there an option for parents to perhaps buy to immunize their children with these vaccines?
Some of the private facilities have vaccines that people can buy, but they are very expensive. So it won't be available for the vast majority of Ghanaians. It will be for very, very few people, really.
I'm sure that there were signs when the stocks started running low. Were there attempts to reiterate or remind those in charge of the procurement processes about the shortage that the country faced, and how far did those engagements go, if at all?
Well, I won't say that we did that as a society, but definitely from the health facilities, we collect data every month on immunizations and the coverages. And so that data feeds into the national data, and the policy makers and those at the helm of affairs actually see it. So on a monthly basis, we submit data on how many children visited the facility, how many children were immunized, how many vaccines were not available, because aside the vaccinations being done in the facilities, the community health nurses also go into the community to give vaccines to those who, for one reason or the other, could not come. So they have mobile sites as well as to catch up on all these children. And with the shortage of vaccines, they didn't even have enough to go into the community to catch those who didn't come to the facility, because even in the facility, we did not have enough. And so all that is documented and forwarded. We forward it as district to as facilities to our district. District submits it to region, and region submits it to the national level. So everybody knows that this is what is happening.
Is there a crisis looming, Dr. Nyarko?
I hope not. I hope that we will get the vaccines. But if we do not get the vaccines, then obviously then we have crisis on our hands. Because you see, we are also seeing a lot of children who are undernourished. And that also predisposes them to having reduced nutrition and reduced immunity. That also predisposes them to infections. So if we have a combination of undernutrition with lack of vaccines, then that really is alarming. But we are hoping that the vaccines will be available as soon as possible, and we will not have any crisis on our hands.
Perhaps finally, how soon would be too late for us to get hands on this vaccine? I think I'm tempted to say that we need them as immediately as last month, but when would we say it's too late and now we are in the thick of dangerous waters now?
Oh, I think it's too late. It's too late, but I mean, we are already in the situation, so we can only hope that we would get the vaccines to try and reverse already the what we have lost, because a lot of parents had come to the point where bringing their children for vaccination was very familiar with them, and we don't want them to stop doing that. And already, if somebody comes once or twice and you tell the person, I don't have, come back again, it's quite discouraging, and we might have people never returning. So we already have a big problem on our hands, and we really hope that we can quickly get on track and go back to where we were and even do better.
Dr. Nyarko, thank you so much for your time with us this morning.
Thank you for having me.
Dr. Mamiya Nyarko is the medical superintendent at the Princess Mary Louise Children's Hospital in Accra. She's also past president of the Pediatric Society of Ghana. We are talking about vaccines shortages, and the fears are that these routine immunization processes that the country has been able to attain, as the country has been able to sustain, may be rolled back if the parents keep being turned away because the vaccines are not in supply. Send Ghana is one of the CSOs that is deeply concerned about this matter, and the country director, the deputy country director, is at the table with us. Dr. Emmanuel, we read the statement at the beginning of the segment, and listening to Dr. Nanaya, does that put your focus, your situation even more, or your advocacy even more in perspective?
It does. You rightly heard what she said about the fact that we should consider this as an emergency. And if it's an emergency, then obviously it does. That is why in our statement we said that government should immediately prioritize the issue of procuring the vaccines. The fact is that we know of the current economic challenges. And so someone would wonder, if you know about this situation, why would you still be calling for such? Because there's no money. But what we are also aware is that the money has already been paid by NHIS, as much as 72 million Ghana cedis. In fact, Gavi,
the money has been paid to who?
It has been paid by NHIS. We are learning to UNICEF, because what happens is that Gavi, as part of our being part
the
of
NHIS, they are friends of GBC.
Yes.
All institutions that provide services are friends of GBC.
Yeah.
We'll be reaching out to them to find out,
Yes.
because we would have to verify some of the claims that you're making.
In fact, I was on another program last week discussing this same vaccine issue, and we raised it. There was an NHIS person there who confirmed. Last year, Ghana was supposed to pay $5.3 million as part of our Gavi co-financing agreement. And it is the 5.3 million that NHIS paid 72 million. If you convert it currently, it's around $5.6 million. And so that means that we have paid what we need to pay. And so it's important government follows up. You remember, during the COVID-19 era too, the Auditor General report showed that as much as $82 million was paid, but the vaccine was not delivered, probably because we didn't follow up. And that is the same situation that we are seeing. So we think that it's an issue of maybe the ministry really not prioritizing this issue, not seeing it as a health emergency. And we believe that that is what has to be done. She rightly said that yes, some of the vaccines you could procure, or you could go to the medical or private medical facilities. But my sister, just let's ask, how many of such private facilities would we even have the vaccines available? Secondly, Ghana is not only Accra. And so if even we're going to have these vaccines in private facilities, it's basically going to be in the big towns. most of the children that are in dire need of these vaccines are not living in Accra. Even those in Accra, how many can really afford it? And so we think that government really needs to look at this. You might wonder why we keep on talking about this, because when we work and we go to these various places, we really see how parents, especially women, are frustrated. Because if you should take a car from your home to a health center and you are told that there are no vaccines, you go again told that there are no vaccines, what do you expect parents to do? Knowing very well that you cannot walk into a pharmacy like you could go and buy paracetamol or buy APC or buy any of such drugs that we have. That is why we are calling on the government to act now. We believe that it's a financing issue. By virtue of our co-financing agreement, Ghana, we are now in what is called the accelerated transition stage. That means that in 2027, Gavi will cease to support us. The fact is, even now that we are having so much support from Gavi, there are challenges. We are not able to meet our obligations. And in fact, for this one, it's not just this current government. 2014, the history is out there. 2014, we missed, and then we had to at least try and meet 2015. 2016, we missed until UNICEF threatened the country. Then we picked 2017.
Do you think we are at risk of that happening, that our international reputation may also be at stake? Of course, the health of the children is more important.
In fact, that for the reputation, it is, I don't know how to describe it. As you rightly read from my statement, there was one of our international meetings that was said that Ghana has become a stubborn child. It came from somebody as far as immunization financing is concerned. Sometimes when you are saying it, people might think that you just want to make noise. But to the extent that you are a Ghanaian and you sit in meetings and your country is being described as a stubborn child when it comes to immunization financing, I don't know what else we want to tell government for government to act and act swiftly. This is about the survival of our children, and so we need to look at it. Maybe in terms of recommendation to government, I was here and we spoke about proposed establishing what is called a public health emergency fund. Public health emergency fund, when it's established, would help in all of these things. We are roping so much from the COVID-19 health levy. Let me ask, what is it at all that we are using that levy for? Projected government budget this year, 2.5 billion or so will be roped in from the COVID-19 health levy. So if the president is watching, or if somebody in government is watching, all that we are saying that, one, we can convert the COVID-19 trust fund to a public health emergency fund and then use the COVID-19 health levy as the main financing way, and then we can look at other means to finance it. We believe that government need to act now. We've been providing so much lip service to childhood immunization. The time to act is now. Thank you.
Dr. Eifa, thank you so much for making the time. Dr. Emmanuel Eifa is the Deputy Country Director for Send Ghana, one of the advocating groups calling for an immediate procurement of vaccines for childhood killer diseases. And the fear is that the children's lives are at risk now. We spoke to Dr. Mamiya Nyako, who is the past president of the Pediatric Society of Ghana, also reiterating similar fears. We'll try in the coming days to get in touch with some officials, perhaps from the Ghana Health Service or from the Ministry of Health, to get us some answers, to give an idea of when the vaccines will be arriving so that the children's lives will be protected from these killer diseases. We'll take a break. When we return, there's more happening on the lighter side of the breakfast table with Valerie, and there's lots of sax music when we return.